Now we're ready, okay.
Head went this way, but the thumb went that way.
Good morning, everyone. I'd like to call this meeting of the Cook County Public Health and Human Services Board to order on this Tuesday, February 18th at 8:30 a.m., or rather it's 8:33. First item is the approval of the consent agenda, which includes our meeting agenda, minutes, financial report, 2024 donations report, abstracts and bills, resignation, renewal of service through North Shore Health, renewal of purchase with Greg Barnier, renewal of purchase with Center for Alcohol and Drug Treatment. Is there anything else to add to the agenda? Are there any items someone would like to pull to discuss from the consent? Else, I'd entertain a motion.
Mr. Chair, I'd like to make a motion to accept the consent agenda as written.
Thank you, Commissioner Sullivan. We have a motion. Is there support?
I'll support that.
All right.
No, go ahead.
We have a lot of support. Commissioner White, thank you. And any further discussion? Hearing or seeing none. All those in favor?
Aye.
Aye. Opposed? Motion passes unanimously.
What's left to do?
Thank you. That moves us down to our staff report. And this morning we have Dan from Carlton County. Welcome, sir, and come on up. And Allison, I don't know if you want to do an introduction or Dan, do you want to introduce yourself or how?
Sure, that was the first line on here. Hi, I'm Dan Plinski. I'm the supervisor of child support with Carlton County. We've been doing the child support work with Cook County since, I believe, 2014. Prior to that, we were also helping train some of the staff that you did have here 2012, 2013, around that time.
Good morning.
Good morning.
Morning.
So I'm going to jump right into it if that's okay then. I want to give you fair warning. I talk really fast, so at any point, please stop me, say slow down, say, hey, I've got a question about that. Definitely, I'm here for as long as you want me, so I will answer all the questions at the end too if you have questions. So just for some data, and again, I believe this was in the packet that you received already. So if I'm reiterating something you've already seen, I apologize. In fiscal year 2024, the state of Minnesota collected $517 million and served 198,000 children. Obviously, Cook County is just a very small portion of that, but an important one. We're measured annually on a handful of performance metrics. Bless you. I'm going to touch on the three that that get focused on the most. And the first one, I'm unbelievably proud of this one, so I'm starting with, this is the star on the top of everything that we do, is our collections on current measure. So what that is every dollar we're charging a non-custodial parent, this is how many of those dollars we collect, right? It's just it's a numerator, denominator metric, and we are at 81.36%. So for every $100 we charge, we get $81.36 collected. It's a 7.97% increase since 2020, so about 8% in the last 5 years, and 16.5% increase since 2015, the year after we took over. So we are now ranked 4th out of the 87 counties in the entire state in this metric. So we are doing really, really great work. But I can't take all the credit for it. So I don't understand, I said this last time I was here, I don't understand all of the economic, the socioeconomic, all of the factors, demographic factors. I don't understand everything with Cook County. I don't understand everything in my own county, to be fair. So some of this is beyond our control. If there were new businesses that opened up, if there was a lot of hiring that went on, if a lot of pay raises happened here, and that helped us with our increases in collections, that was beyond our control. But I do want to give my staff the kudos for the things that are within our control, right? The contacts that we have with clients, the income withholding orders and information that goes out to employers to make sure that we are collecting the money appropriately, getting right-sized orders. So if we look at a court order and we see, hey, this doesn't look right, we get them into court to get that updated, right? So many things change in people's lives. You get new jobs, you lose jobs, you move, you get on assistance, you get off of assistance. So there's so much that is within our control that I believe we did really, really good work on. I want to say I'd put our customer service in Carlton County up against anybody in the region, if not the state. Again, I don't know every 87 other counties, so maybe they do some really great work too. I'm not putting anybody else down. And not to pick on anybody, but there is a county in our region who has a 72-hour callback policy. So imagine calling and needing some information about your finances or your kids. I mean, because that's what we're dealing with, right? Money and kiddos. And saying, hey, we'll call you back in 3 business days. I mean, I couldn't imagine that. I've got a 17-year-old now, but I couldn't imagine, that when he was a little kid if I needed some information. We answer our phones live whenever possible. If not, we call you back as soon as possible or by end of day. I mean, if you called at 3:59 and we close at 4, I can't get you back by end of day, right? But within reason, we're calling people back immediately. We're calling employers back immediately. We're getting healthcare information, from these big healthcare companies as fast as we can. I mean, sometimes you're on hold for an hour with them, but otherwise we're getting it as fast as we can to get all this information updated. We had a few changes within the last little over a year, not quite a year and a half. Some personnel changes, some people who had moved to new positions and one retirement. What we did was take a good hard look at what made the most sense for what we were doing. So every child support agency across the state can do things. So it's a state-run, county-administered program, right? So every county can do things the way they want to do things. So we specialize. We have people who know very specific things. Maybe I'm the person who goes to court and I establish court orders and I modify court orders and I know the ins and outs of the law and going to court. Maybe I'm that person. Or maybe I'm the person who, again, I take the phone calls every day, I work with the employers every day, and I work with the healthcare companies every day, right? I know the ins and outs of what that's going to look like. We changed that up just a little bit within the last year or so by putting ACEs in their places. It's a term I stole from an electronic document management system that we worked with, but we did the ACEs in their places model, where if I knew, hey, if you're better on the phones, we're going to put you on the phones. If you're better in court, we're going to put you in court, right? Put you where it makes sense to put you. And I want to use one example of something that went really well with that. So we have an interstate caseload. And so that means it's only about, I think it's 15 cases up here in Cook County. So it's not a lot, but it is a group of cases. And what those are cases where, let's say, parents had a kiddo here in Minnesota, but then a non-custodial parent moved over to Wisconsin. We're asking Wisconsin, hey, can you collect this support from us because he's working, wherever he's working, down in Wisconsin Dells or something like that. Can you collect that money for us? They collect it, they send it, from state to state to us, and vice versa. They have a parent who says, hey, or they have a case, where one of the parents moved over here and is working at Lutzen or something, and they say, hey, can you collect that money for us through that employer? You know the ins and outs of it, and then send it over to us. So with putting ACEs in their places, we changed 2 staff to have them do the interstate work, so they can work, primarily just on that set of cases. They increased collections almost 10% this last year on that alone. So I think what we're doing, it's going to take longer than just a year to see, all the, metrics and how they shake out. But just in 1 year, just with a couple of people changing what they were doing, we saw some really good results. So that's the shiny star. That's the really good one. Paternity establishment. Now this is the one we have trouble with. This measure up here, we're at 90.41%. The state wants us at 90 or above. We're 0.41% above, so we're barely above. And this one is harder to explain because it takes the prior year, so 2023's, every case that we have, if we look at how paternity was established. So if mom and dad are married and they have a kid, paternity is automatically established. That is their kid, legally already their kid. Usually you don't have to go to court unless something, for some reason you still want support to be paid or something. We don't get credit for those cases because we didn't do anything. Mom and dad were married and kid was born. What we do get credit for is when we get them to sign recognitions of parentages or ropes, or if we get genetic testing done, right? We swab them. We send them into a company. It says, yes, dad is 99.9999% the dad. We bring them into court. A judge adjudicates. We get credit for that because we're doing the work on it. We don't have any cases that we haven't established paternity on, where we haven't done the work, and we're still only at 90.41%. The reason is we don't have control over what happened 2 years ago compared to what happened last year. So the examples I have are, let's say we did adjudicate or we did get a rope signed in 2023, but that family moved out. of Cook County, right? That they're somewhere else in the state, they moved to another state, we don't have an order with them anymore, their order closed for some reason, God forbid somebody passed away, there's many reasons why that case doesn't exist anymore the second year, and so we can't get credit for it. It's a numerator-denominator like conundrum, I guess, where we have no control over what happened the prior year because those cases may not exist anymore. So all that being said, we're barely above the threshold. We were on a performance improvement plan last year for this because we were at 89% and they want us at 90. So we changed 2 cases and moved up to 90.5% here now. I have a feeling this is going to kind of undulate. There's going to be ebbs and flows to this, again, with the year-over-year numerators and denominators of what we have to deal with. So again, I just want to assure you that we are doing the work on all of these cases. We are establishing paternity on every case that we can. This kind of connects to the next measure. It's something I'm going to explain, and it's orders established. So not just establishing paternity, who's the dad, it's making sure that we have a child support order, because we can't collect child support unless there's an order that tells us we're allowed to collect child support. So we're at 87.5% of all of our cases have an order established on them. The state wants us at 80%. And the reason the state gives us that 20% grace is because they understand that there's going to be cases you just can't get an order established on. We may not be able to establish paternity on somebody because the mother doesn't know who it is. We may not be able to establish an order on somebody because the mother does know who the father is, but we can't find the father. They're in the wind. They're gone. There's no address for them. They're couch hopping. They've moved states. They've moved countries. We just can't find them. So the state realizes there's going to be a group of cases that you just can't. They sit there. They're open. There's nothing you can do on them. The mother either wants an order or paternity established, or they're receiving medical assistance, in which case we automatically get a referral, and we're trying to establish an order on that case. We do lead the state in this measure, though, so that kind of is why it goes hand in hand. Is on every case that we get, we are working them appropriately. There's just sometimes when our hands are tied and there's nothing that we can do with those cases. We're also self-audited every year on random cases to ensure accuracy on a whole number of factors. If we've established an order correctly, if we're charging correctly, if we've got medical charging correctly on it, if we're contacting another state correctly, a whole bunch of different things. Cook County didn't have any cases pulled for the audit this year, but Carlton had 5 cases pulled and we were 100% compliant. So I just wanted to give that to you as well to let you know that if a case had been pulled, I'm sure that we would be 100% compliant in Cook County as well. There's also some major changes that I'd like to touch on. So those are the performance metrics. First and definitely foremost, we have iPay Online that is coming. So this is going to be the first time, welcome to the 21st century child support, that we're going to be able to collect payments online. So right now, people write checks and they send them in, or they come into the office and they give you cash, or they write you a check, and the accounting department writes a check and sends it down to the state, and it's an antiquated system, right? We can pay any other bill that we have, almost any other bill maybe, online. My Proctor Public Utilities, actually, for a long time, I couldn't do it online. So not everybody can do it online. They just switched to online recently. So it's going to be e-check, debit and credit cards, e-wallets such as PayPal, Apple Pay, Google Pay, Venmo, etc. It's supposed to go live in early March. The interim director of child support actually was in a meeting with me, and she said, don't quote me on that, though, because I'm going to get in trouble if it doesn't go live early March, because everybody wants this. She said, we're working on it as hard as we can. There will be a small fee if you use an e-wallet or a debit or a credit card. I think it's 2.95%. But if you use an e-check, it will be free. We have an Advancing Equity in Child Support grant. So the Minnesota Child Support Division started working on a federally funded grant to examine diversity, equity, and inclusion within child support and any issues that we may have. They wanted to identify barriers faced by historically underserved populations. They added 15 additional race and ethnicity options to capture the ways the parents of the program see themselves. This will improve the program's ability to make data-driven decisions. We don't know at this point what that's going to look like. We don't know what the data-driven decisions are going to look like. What they are going to look like. We're still in the data gathering time period right now. So we are doing our best to update fields, as good as we can. We don't guess on what somebody's ethnicity or race are. So again, this is what the client tells us or what the client indicates, like in their paperwork or something. We had another grant. It's called the Safe Access for Victims of Economic Security. So we continued to work on this grant. Was there a question? I'm so sorry. I just kept talking.
No.
I
I
heard something.
was
Okay.
just needing to support my head. That's all.
Okay. making it safer for victims and survivors of domestic abuse to learn about child support services, stay safe while receiving those services, and understand the options if they're not safe, if they don't feel safe to receive services. Over 140 people at the statewide level are now involved in the work of this grant. We now have the ability to trust what parents are telling us if they feel unsafe. So this connects directly with an income maintenance system called Good Cause, where somebody can say, I have good cause to not have you start child support for me. I know I have medical assistance, and statute says that this will create an automatic referral for child support, but I have reason to not. And that usually entails getting, a copy of an OFP or a harassment order, corroborating evidence from your neighbor or kiddo or something like that. It's really hard to get that information sometimes. Sometimes that information doesn't exist. Not every time there's domestic violence are the police called, so there's not always a report, on the back end of it. So this gives us the ability to trust more often. If they want to tell us or put it in writing that they feel unsafe and believe, because of whatever reason it may be, we're not going to question it. I'm not going to question why you feel unsafe or not, or what happened to you, or give me the details of what exactly happened. I'm going to trust you, and I'm going to say, okay, if you feel unsafe, and if I try to go after child support from this other individual, harm may come to you, then I'm stopping right here. Then the state is allowing us the ability to just stop it right there. I saw a report, and it was from Texas, not Minnesota, so there's probably some correlation, but I don't want to say our state is exactly the same. But it was 30% of individuals who were involved in child support cases had domestic violence in their past. So I don't know what the number is just generally in the public, but 30% is a big number. So we can, potentially assume that 3 out of every 10, cases may have this, and again, we will be able to just trust what the custodial parent is telling us. Yeah.
Mr. Chair, appreciate your presentation. A question relative to that point that you just made, that if the person that is supposed to be contributing to the child care is seeing the spouse as the cause of the problem, as opposed to an agency that is holding them accountable. I mean, it's a fine line probably separating that, but how we try to diffuse those numbers where we have abuse. I mean, if that figure is abuse present prior to the claim for child support, then it just means it's one of those things that contributes to being problematic because there was abuse that was prevalent prior to the judgment with child abuse. If the 30% is related to the fact that that requirement is in place, and so then the abuser sees the spouse as the cause of the problem, those are two separate things to understand it. If a lot of times you'll hear a leader say, let me take the hit on this, because I don't want this to reflect on you. I don't want them to see you in this. I want them to see me. So if the agency understands that, then what we try to do is we try to say, this is a requirement based upon a structure that's set up that's healthy and it's just, and so we're trying to take that retaliation against the spouse away from that. I mean, anytime you get figures that are significant in that regard, it's how do we remedy, how do we approach that in a way that's healthy and still doesn't absolve the individual of their responsibility.
Yeah.
If that makes any sense.
I think so. Did you ask me a question in there? I'm sorry.
Well, the question was that in the scenario that you presented, is the 30% figure relative to the abuse figures that pre-existing prior to the requirement for complying with, the requirement to pay spousal support? That was one question. The other question is, do we see the wisdom in trying to deflect the onus from the spouse to the agency, just trying to comply with what we've set up as structure that's healthy for society? So
yeah, I'll try to answer the questions, because again, this was a study done in Texas, so I don't want to take their information and use it as gospel right here, but I don't believe it was prior to the creation of the child support order was the 30%. I believe it was parents involved in child support. So I think it could have been something that happened after, right? So you brought them into court, you ordered non-custodial parent to pay, abuse happened afterwards, right? So I think it's the understanding that it's
It's in response to the
Yeah,
judgment.
Ad hoc ad hoc. There's a Latin term after it, therefore because of it. It's not that. Not necessarily. It's not because of the thing did the abuse happen, but it could have been at any stage of it. It could have been prior to, could have been during, could have been after. So the deflecting and the taking the onus on it is, in the income maintenance world, the good cause that I had explained. What that does is it stops everything. The non-custodial parent may not even know that this is happening, doesn't know that the mother had come in to talk to us, doesn't know, or the custodial parent, sorry, not always a mother, that the custodial parent had come in to talk to us, that the custodial parent had applied for services, had gotten those services, whatever it may be. It it stops it right there and says, we have no business involving the other person whatsoever. So there shouldn't even be a reason to need to deflect because the other person has no knowledge of the ongoings that are happening, if that answers.
Yeah, that puts it in context to help understand what are we doing to try to mitigate issues that become problematic,
Yeah.
But
And again, so the state is taking this on too. So speaking of state-run, county-administered, child support is a federal program. So the federal government gives the state the money to actually decide how they're going to run it. The state of Minnesota has decided to have counties run it, and then the state is the one. We're very happy that they're the ones who are going out. I don't have a grant writer, so they're going out and getting these grants to actually then come back and do this work. So we're very grateful of the work that they've done to allow us to do this, right? I never wanted to be the one who denied a good cause because there wasn't enough evidence of the abuse actually happening, right? Now I can just say, I trust you. I don't need any more evidence than your word. Why am I asking you for proof of this? Why am I asking you to go to your neighbor and say, remember that last night when you heard that screaming match and whatever and you saw bruises? Write something up for me because I have to go bring that to the government now. That felt icky to do that. So I feel good about what we have now.
thank you.
Yeah. Post hoc ergo propter hoc. After it, therefore, because of it. Took me a
I think
second.
that'll be our new words. Or
Yeah.
whatever.
Yeah, right. If you take anything today, take that with you. Take the Latin lesson. I'm sorry. I don't know why I went off on that. And the last thing I had too was we had a driver's license suspension pilot impact evaluation report. So one of the tools in the tool chest of what child support can do is suspend a driver's license, right? So if you're not paying, but you have the ability to, you're not working, but you have the ability to, you're just deciding not to, we can suspend your driver's license because almost everybody needs a driver's license. People still decide to drive without them, so it's not the best tool, but it is a tool there. What they determined and changed statute 518A.65 changed. There's like 10 different reasons. So our system was built in 1996, the one that we use. It looks like DOS, if anybody's familiar with DOS. It's, you tab through and you type in what you need to type in, you hit enter, and the thing does what it needs to do, right? I don't mean to make it sound easy because it's not. There's like 500 different screens that we can transmit through and put information in on there. But driver's license suspension was automatic. So if you met the criteria that you hadn't been making your payments and it was a long enough period of time, the system was just going to automatically suspend your driver's license. We interface with DVS, DPS. It says suspend this person's driver's license. So now the statute changed to say there's a lot of reasons why people can't be making these payments. So we want to look at the people who have an order but have the inability to pay. Something happened, right? Let's say you just had an injury at work. You got Social Security paperwork pending because of an injury. You were incarcerated. You just got out of incarceration. Orders state that we can suspend. Sometimes they state we can suspend while incarcerated, or we bring it in and we suspend it during incarceration. But that doesn't immediately mean somebody gets out of jail and has a job the next day, right? We understand it's going to take you a little while. You got to apply for jobs. You got to interview. You got to get these jobs. And so it gives us 11 new reasons why we don't suspend your driver's license. So there's coding that we can put in there now that says, hey, again, we've looked at this. We've softened a little bit to say it doesn't just automatically happen. You don't have a driver's license. Now you can't even go look for a job because you don't have a license to go around. Now it says, hey, we've got some reasons why we're not going to suspend your license. There's timelines involved with that, right? We're going to re-review this in a month or 3 months or 6 months because of whatever your situation is, and then we'll look at suspending your license then. So there's kind of this overall I call it the kinder and gentler child support that we're looking at. When I first started 13 years ago, there's expenses of birth, right? So birth of a child, there's expenses. If medical assistance paid for that, we found out who the father was, we would charge the father half of that. Well, birthing expenses can be tens of thousands of dollars, right? So immediately you'd have a child support order and have $10,000 in back pay, right? I mean, sometimes people would just say, I'm never going to pay this. Why do I even want to go get a job to start paying this? And so we were putting people behind the 8 ball right away by, making it harder. That's just one example of the kinder and gentler child support that we're looking at now. And what we're trying to do is caseload numbers are dropping across the state. They're dropping across the country, actually. Minnesota is part of I don't know what it's called. There's 3 states that are all working together to try to figure out what the heck is going on and why our child support number is dropping. And there's a whole bunch of different reasons. We live in the world now, again, speaking of electronic payments, I could just Venmo somebody that money instead of having to get like an outside agency involved to collect a payment for me to send it appropriately to my debit card or to my bank account. You could just say, hey, Venmo me, I had to pay for soccer cleats, give me $50, and that stuff can kind of happen more behind the scenes. All that being said, the kinder and gentler and softer child support that Minnesota is trying to create is supposed to make it easier for families to be involved with it and feel okay with the work that we're doing. We're not a cut and dry, rigid, mean child support, that maybe it used to be. I don't want to say they were mean, but the difference that it was, back in the 80s and 90s. So I have faith that this is all going to work out eventually, but like I said earlier, with some of the changes that I just made within my own unit, I believe a lot more time is needed to determine if this is going to work or not. These things that have just changed within the last year and a half, we don't know if, what exactly they're going to do, but I'm excited, I guess, for the future of child support and what that's going to mean.
Yeah, you might want to add smarter into the kinder, gentler, because it seems like some of these initiatives are really trying to get ahead of causing more problems or just the nuances in there. So
yeah, they seem to make sense, don't they? That's how I look at it too.
Yeah.
Smarter,
And-
I like that.
yeah, and at least worth a shot, right? And then as the data comes in, you'll be able to adjust, and just having that flexibility, I think, is really important.
Yeah.
So, thank you.
Yeah, you bet.
Any questions, further questions for Dan? Please, Mr. Gamble.
Yeah, thank you, Mr. Chair. Dan, you used the phrase, the state realizes. And when you were giving some of your benchmarks that you had to achieve, when in the second set that you were speaking of, which was the 80, I think you used the phrase at that point that the state realizes. And you've had 13 years doing this, so if you're in partnership with the state, federal, whomever you're working with, if you feel that there's a reasonableness in everybody being focused on the objective and that reasonableness plays into it, it makes the job less stressful. When expectations are set with people that don't have the empathy or the understanding, the context, then you lose the reasonableness. And so it's important in relationships, partnerships that are reliant on each other, that state realizes, that we realize, and that we work for our objective, but we work in a context that allows that discussion so we really understand where we're coming from. And that's key to what we're looking at right now with the governor's budget, is that do they realize? And in contentious situations, sometimes people don't want to realize. They don't want to have the discussion. They just want to solve their problems, and this is one way of doing it without empathy for the people and how their decision affects them. So I think we continue to want to encourage and call one another to have open discussions that are honest and find ways that address that are less painful. And when we find ourselves in financial situations where we're pinched, we can identify with that, but we can't put that burden on somebody else and not realize what our decision is doing to them. So you've had enough years to know in the relationship with the agencies that you're working with whether or not you see that reasonableness, extended. And each of us, when it comes to budgets, have to make decisions based upon priorities. And if we are excluded from that list of priorities, or our priorities are minimized, it just puts a lot of weightiness on a position in human resources and public health it's already weighty because of the emotional nature of what it is. So that's where we want to respectfully, I'll say, confront these things so that we try to call people to a sense of reasonableness and empathy and understanding what happens when we make decisions like that without realizing their fallout. So, yeah.
I am on the Child Support Advisory Committee, so I represent the 8 counties in the Northeast region. I couldn't even name all 8 right now, so don't quote me if it goes over to Cooch, down to Pine. I forget exactly where it goes. But when I say the state realizes, I guess maybe I shouldn't paint the state with such a wide brush, but people that I'm in meetings with, you know, again, our commissioner of, our, whoever the head of child support was, I can't think of her title right now. She moved on to she's the one of the assistant commissioners at the DCYF that was created down at the state. So we have an interim, chair of child support or head of child support right now. But I'm in meetings with her every quarter where a lot of this stuff is talked about, right? So I agree. It's them realizing, I guess, that we need to be reasonable with the work that we're doing now. Yeah, there's some common sense to it, I believe, some smartness, I believe. I mean, I'm part of the meeting, so I feel like I'm one of the smart ones at the table, I guess, or one of the ones with common sense. But I think that same feeling is going all the way across the state, across child support across the state anyway. And again, sounds like it's happening federally. I'm not in any of the federal meetings, so I don't know that for a fact. But it sounds like a lot of states are looking at a lot of these same, programs or initiatives or grants or whatever, that we're looking at.
Wouldn't you say that the declining numbers in child support is reflective of the demographics? I mean, isn't that one significant element of it?
Yeah, childbirths are down just to begin with.
Yeah.
So yeah.
Yeah.
That-
If you don't
absolutely.
have as many, you're not going to.
Yeah. I don't know what your birth numbers are here. I think many years ago, I think I reached out to the hospital and got those numbers, like how many childbirths were actually, I don't even know where your hospital is. What is that?
It's about
40 a year? Okay. Do you think that's gone down? No, I'm asking questions.
I've been steady for about 10 years.
Okay.
I haven't gone further back than
Sure.
that, but
Sure.
it's pretty steady.
Okay. Yeah. And again, I don't know, are a lot of people moving to Cook County? Are they moving out of Cook County? Is it kind of a mix of the two? What are the this is where I don't know all of the demographic factors up here, the economic, socioeconomic. I don't understand everything, and I don't think I ever will. I got to deal with whatever it is, that comes out in our numbers. We just have to deal with it. So.
As long as you know Latin, you'll be okay.
Yeah, okay. Thanks. That's all I know. Don't have to be anything else.
We certainly appreciate you at the state advisory table. Really appreciate your advocacy and just your knowledge of and years of experience dealing with these issues and how we can best address it, and particularly Cook counties too. Just the knowledge there. So
Yeah. Thanks.
yeah. Any other questions for Dan?
Hey, Frank.
I apologize. Winter does not like my truck.
Oh, I'm sorry. No worries. As far as we're concerned, I hope there's no worries as far as you're concerned. Okay, well, thank you, Dan.
Thanks, Dan.
Thanks for having
Thanks
me.
for making the drive and giving a
You
great
bet.
presentation and doing the great work that you do.
Thanks. I was telling Allison, looking over the lake was beautiful today with the sea smoke and the sunrise coming up.
Yeah.
So
Magic.
It was a nice drive.
Yeah.
Thank you all.
Have a great day.
Thank you.
You too.
All right, that moves us down to our director's report.
I'll start just by echoing the gratitude to Dan and the Carlton County Child Support Team for the great work they're doing on behalf of Cook County families. We've been really fortunate to have this partnership now since about 2013, 2014, right around the time both Dan and I started our work with Carlton and Cook counties respectively. So it's been a good arrangement for our families, and obviously great things happening in the state in terms of really looking at the program and ensuring that it's not creating harm when it's supposed to be helping families, or it's at least mitigating the harm that can come. All right, so staff updates. Included in your agenda materials was an updated organizational chart reflecting our 2 current vacancies within the department, those being the Adult and Home and Community-Based Services Supervisor and Family Services Supervisor. On the consent agenda, you accepted with regret the resignation of Al Kuenzli after just over a year of service with the department as a children's mental health case manager. We're grateful to Al for their work with families and youth since they started with us in September of 2023. We're very excited to be welcoming Sarah Eisenreich later this month as our mental health crisis response worker. Sarah is a registered nurse with experience in critical care units in the emergency department, so we'll bring a a high degree of experience and professionalism in crisis situations, and we're grateful to have that position filled once again, as it's been vacant consistently over the last couple years. We have extended an offer for the Children and Family Services Case Manager position. We've had a hard time connecting with the applicant, so may end up needing to repost that position, unfortunately. Grateful for the support of Tammy Matheson, who is a licensed social worker with a temporary social work agency who's providing case management services within the children's mental health area. And finally, last week and this week are interviewing for that adult and home and community-based services position following Martina Johnson's transition to the Department of Human Services earlier this month. We had a strong slate of applicants, and I'm hopeful that we'll have a hiring recommendation before the next Public Health and Human Services Board meeting. Any questions on staff updates before I move on? One of the big initiatives of the month has been the implementation of our electronic medical record system for behavioral health. We went live on February 3rd with Credible, which is the client record management system for mobile crisis response and our outpatient substance use disorder treatment program. So that has been taking up a lot of time. But we're really optimistic about the efficiencies that will provide us and our ability to capture revenue more consistently and efficiently than we have with our historical document management system, or electronic medical record, rather, for wilderness outpatient treatment programs. Grace was on the radio recently talking about the uptick in viruses circulating in our community, how to keep yourself and your loved ones healthy. Both respiratory illness and norovirus, or the stomach virus, have been increasingly prevalent. So WTIP has that posted on the website if you want to give it a listen. We are working on finding a site in Grand Marais to place a public health or harm reduction vending machine. This is one of the outcomes of our multi-year federal rural communities opioid response grant program. To date, we've installed harm reduction cabinets both in the courthouse. I believe we're in the process of installing them at the community center. And the benefit of the harm reduction or public health vending machines is that they will be accessible 24/7 at a location that's open to the public. Also within prevention, our coalition continues to meet on a monthly basis, including this afternoon. That's a hybrid meeting at Cook County Higher Ed and on Zoom. The Young Adult Life Leaders, or YAL program, is successfully engaging 4 young people in bi-weekly evening trainings on how to be a peer mental health support person. We're working with the Community Health Board to create more communications and education materials on prolonged power outages and safety as a part of our emergency preparedness work. We reviewed the draft of this magnet just last week with our local emergency preparedness committee to get some feedback, and we'll hope to be rolling that out later this spring. The Food Access Council continues to set the foundation for promoting access to affordable, healthy foods. This is one of the priorities in our 5-year community health assessment plan. We were awarded a DEED, or Department of Employment and Economic Development Child Care Economic Development Grant. The total grant award is $385,000. And as outlined in the request for proposals, this grant will be used to increase the number of quality child care providers and to support economic development through the strengthening of our local child care system.
Allison, could you bring the mic closer?
Yeah, you bet.
Thank you.
Thank you. I don't have much more to say.
Oh.
We're paying close attention, as Dan mentioned, or as Commissioner Gamble mentioned, to the governor's budget and the impacts that could have potentially on our local delivery of services and local budget. One of the line items that the proposal is proposing to shift to counties is in disability waiver spending. So the state is seeing considerable growth in both state and federal dollars that are going out to support individuals with disabilities, primarily in residential settings. So based on the draft language in the governor's proposal, there's been an effort at AMC and the county level to look at what these projected shifts, how they could impact local budgets. So I, with the support of Marissa, our disability waiver case manager was able to pull 3 years, or the last 2 years, and year-to-date spending for disability waivers. This includes developmental disabilities, CADT, which is Community Access for Disability Inclusion, CAC, which I'm not going to be able to rattle off what that acronym is, and then brain injury waivers. In the governor's proposal, the shift is 5% of the state portion. So as with a lot of our spending as a department in human services, there's a federal portion and a state portion. So what the governor is proposing is that 5% of that state portion be shifted to counties. So based on our historical and projected spending in that area, if that 5% would be shifted to the county, we'd be looking at just over $30,000 additional expense for disability waivers. And again, that's 5% of the state portion. Our historical spending in disability waivers is right around $1.5 million. And again, these funds aren't currently reflected in our budget. They're going directly from the state to residential service providers for individuals who are in Cook County or are Cook County residents who are placed outside of the county on one of these disability waivers. Also within the governor's proposal is an increase in the county cost share for the Behavioral Health Fund. The Behavioral Health Fund was formerly called the Consolidated Chemical Dependency Treatment Fund. And with all of the reforms that went into effect statewide for substance use disorders over the last few years, that has been renamed the Behavioral Health Fund. Currently, the county cost share is 23% of all of the behavioral health funds for county residents are billed to the counties. What the governor is proposing is that increase to 50%. Based on our small numbers, we're projecting minimal impact there, right around $2,000, if that were to increase from the current 23% to 50%. Also in the budget proposal is the elimination of the Behavioral Health Fund administrative revenue to counties. Historically, that number has varied. Last year, it was just about $6,000. So again, a small impact there based on our population. Other proposals in the governor's budget are harder to determine what that impact would be. One is the competency restoration. This would be a new service level that would be billed to counties for residents who are at a state-operated facility and are in a legal process that's determined that they aren't competent to stand trial when they've committed a crime due to their either mental illness or substance use. So again, harder to track what that impact would be as it's a new service. And then additional cost share would be increasing the share for counties for individuals who are placed in a sex offender treatment, either at Moose Lake or St. Peter. We don't have anyone in our county currently who's in treatment at one of those programs, so we're unable to project what that impact would be based on either current or historical spending. Additionally, the cannabis aid, local cannabis aid to counties is also in jeopardy. Our 2024 allocation was $2,000, just over $2,000. Again, harder to estimate what that impact would be as it's based on a 10% tax on cannabis and low potency edible sales. So it'd likely increase in 2025 and into the future as retail sales become more prevalent. So all said and done, if those cost shifts were to go into effect, if they were applied to the 2025 budget, we don't have a 2026 budget to analyze yet. So if those were applied to our 2025 budget, with the increase in expenditures and the decrease in revenue, the total anticipated impact to the budget would be about $47,000. Not insignificant, but certainly not the multiple millions of dollars that some of our other counties in the region and state are projecting.
Yeah, sitting through the walkthrough with DHS, they were talking those percentages, and it was pretty scary. But it's very helpful to get dollars with those. So thank you for doing the legwork there and putting it in perspective, because yeah, it's very alarming sitting through that all the shift changes.
Yeah, absolutely. Yes, I'm glad you were able to be a part of that presentation. Last week, Commissioner Mills is referring to a walkthrough of the governor's budget with state staff from the Department of Human Services and Department of Children, Youth, and Families. Commissioner Mills was attending, I believe, as a representative of the advisory council for the transition from DHS to DCYF, which also included in the agenda materials was a handout summarizing the transition, both the timeline of transition from programs to the Department of Human Services to the Department of Children, Youth, and Families as of January of this year. Embedded within that document are links to much more information, including the Department of Children, Youth, and Families Implementation Office website. I think that's all I had.
That gets us through D as well, right?
That gets us through D as well.
Yep.
Yep, I shifted things around a little bit there.
Yeah, Randall.
Yeah. Is this the proposed governor's budget, or it's not in effect yet?
Right,
So
it's just proposed at this
people can
point.
respond to it?
And will. Yeah.
Yeah.
There's going to be a lot of horse trading, I think, too. It's hard to know. I don't know. I just don't have the experience with the governor's budget to see how things change and shift and the positioning involved in all that. But, yeah, it was also, I mean, it was alarming to hear the percentage changes for those shifts. But it was also encouraging just hearing from DHS, yes, we do realize the significance of these shifts and how difficult it can be for counties. And she was trying to communicate the difficult position the state is in with the budget forecasts, the deficits in the future too, and just trying to find that best path forward. And she really wanted to emphasize we're all working on this together. It's just how can we move forward and do least harm with shifts and all that. So both frustrating, but also encouraging just to have that communication and yeah, realization on their end, just that they're not just cut because we can. It's more like, oh boy, we're in a tough spot and what can we do? And this is really important for future generations even, but we need to do something. So I'm curious to see where things go. Commissioner Campbell.
Yeah, thank you, Mr. Chair. Thank you, Allison. The numbers help, I think, for, we'll call it public consumption, that it would be interesting to know these programs, their start date, and then how we track that from a financial standpoint. So when these programs started, if they were started because there were grant funds that came either on a state or federal level to begin these programs, and then how these programs have fluctuated over time so that we see the amount that we're investing that is a portion of our levy, so to speak, and how much is paid that comes from these programs that were funded. And if we see that there's funding that's being withdrawn or questioned, then the impact we would see based upon the numbers we have. So you, in effect, gave us those numbers, but if we were to track them from a graph standpoint from their inception within reason, it would visually give us an idea that would, be informative. The other thing, I think, when we see the Association of Minnesota Counties going and testifying, and individuals from different counties testifying on this, that if we had something that visually showed that, its impact to the counties overall with these programs, you can't ignore what you're seeing. And you can speak to it, verbally and have a lot of statistics, but sometimes it doesn't get assimilated like something that's visual when you look at it and just say, here's a program, started here, it was funded here, and then funds got dropped off. And it's like you have enthusiasm and whatever, but you need to be in it for the long term with the intention that seeded the money in the first place, and then stay with it. And if you see how it's affecting us, then you see how much of the burden is falling on the levy and how much is, being partnered with whatever state or federal funds. But, there's enough to do anyway, but if the figures could just go into a graph form in that regard, I think it'd be easier for the community to understand it. It would give us some ammunition, so to speak, when we go to legislators. We're just one county, and we know with in-home services or out-of-home placement costs, 1 or 2 families, and whoa, the budget just goes crazy. So we have to deal with that reality, but it'd be helpful. So I appreciate the work that went into the figures as you represented those in dollars, but if we could see it over the long term, we'd see what are those dollars getting us for their investment and how much are we investing as opposed to other agencies. So, but.
Thank you for your question, Commissioner. And there is a resource that's publicly available through the State Department of Human Services, and it's the County Cost Report. And I can commit before our next meeting to pull some information together from the cost report to illustrate how that has changed over time. The downfall there is that it's not up to date. I believe the most recent year available is 2020, but we would at least be able to see over, a 10-year period, how has that the county's share of paying for these services changed over time.
Yeah. The other thing is, if we look at where those projected cuts are, if you have an increase in an area of need that we're seeing that is burgeoning, and yet we're reducing costs, that doesn't seem to connect with, just common sense. It's like we've got a need here that is growing, so we should contribute more to try to reduce, the fallout of a problem that's getting bigger. So if you take money away from it and you see it growing, it just doesn't seem to, from a common sense standpoint, doesn't make sense. The other thing which we can't appreciate unless we get really involved in it is where the prioritization, what's driving it when it comes to what we do with the dollars we do have. And in our discussion that we had with Dan here, it's this reasonableness and the fact that we're saying that these various entities realize, and our challenge is to make sure that the individuals do realize, respectfully, you do realize the nature of the problem, which is growing. Now's not the time to pull back. But what are the priorities that are causing you to do that? So,
Yeah, it's basically money. That's where the pressure is coming from, is, nope, we can't spend more money, so we have to do some trimming.
Which makes sense. And that's what responsibility is. Fiscal responsibility is making difficult decisions. But in the community, in our sense, and in the state, in the broader, context, when we shift dollars, what's the rationale behind it? And if it makes sense, and say we don't like it, but it makes sense. But if it's driven by ideology or politics or who or whatever else, then people have a reason to say it doesn't make sense, and you just scratch your head.
Yeah.
So we understand it's basically dollars.
Yeah.
I think, in our packet to see the monies that have come from organizations, the donations and things like that, that demonstrates people that are willing to come along and help.
Yeah.
And that's to be applauded when you see that partnership. So.
Yeah, we have a strong community on that front for sure. Okay. Well, thank you. Any other, Frank, I'm sorry.
Yeah, And I would just like to give a big kudos for that $385,000 childcare grant. I know that just didn't magically appear in your inbox one day. I'm sure a lot of work went into that. And congratulations to you and your staff for putting that together. I did have a couple of questions on it. Is that a one-year grant or a multi-year grant, or?
It's a one-year grant that is based on the state fiscal year, so it will extend over 2 county calendar budget years.
Okay. And it's earmarked for increasing the number of childcare slots. And what was your strategy in that? Is it training new childcare workers, or establishing new facilities, or wage supplements, or what was your plan for turning that from money to slots?
Yes, so it is a multi-pronged strategy that will provide ongoing support to some of the existing programs as a part of the child care pilot, professional development, wage enhancement, substitute pool. I'm just pulling up my notes from Nancy, and all credit to Nancy, who is our grant writer and spearheads all of our child care initiatives locally. I'm just referencing my notes here to see what is new in this new grant, as I know there are a few new initiatives. So something that is included in that grant program is additional partnership with housing developers. Nancy's working with a local housing developer who's interested in setting aside a unit, perhaps, in the development for childcare. Increased engagement with the hospitality industry, including non-traditional hours of care, drop-in. These programs have different licensing rules, but there are some providers within the region that Nancy is engaged with to learn more from, that she met through one of the panels that she's been asked to participate in. Again, ongoing funds for startup, expansion, professional development of existing child care providers, potential child care providers, that mentorship program. So our current grant ends on June 30th, and the new grant will run through the calendar year and into next year. Also funded by the grant is expansion of the North Stars, the Cook County North Stars website, with additional pages featuring local child care providers, social media engagement, and looking at the success of the Aging Well Resources Hub that was spearheaded by the Aging Coalition to develop our child care website similarly. So more resource information for families and providers.
Thank you.
Thanks for the question, and thank you to Nancy again for leading that grant writing and delivery of services for child care providers.
Any other questions for Allison?
I just have one more update, which is to tee up our items for board action, the contract addendums with Sawtooth Mountain Clinic. Just a note on why I didn't put these on the consent agenda, as I did with all of the other contract renewals, as there were a few changes this year. Notably, the follow-along program, which historically was its own subcontract, was incorporated within perinatal nursing supports. Funds were shifted from the outreach program to WIC, or Women, Infants, and Children's, due to historical and projected spending increases in that program. And Grace is here as well if there are any specific questions on those grants, as she did a great deal of work with Sawtooth Clinic, their staff, and our fiscal team on developing budgets and subcontracts for the new year that are in alignment with what we're seeing in terms of programmatic shifts.
Any questions there for Grace or Allison? All right. Well, that brings us right down to that item for board action, the renewal of the contract with the addendums for Sawtooth Mountain Clinic. Feel free to ask questions, or I'd entertain a motion if we're ready for that.
I'll make the motion to approve the renewal of contract addendum with Sawtooth Mountain Clinic.
Thank you, Commissioner White. We have a motion. Is there support?
Support.
Thank you, Commissioner Selvin. We have a motion and support. Any further discussion? Hearing or seeing none, all in favor?
Aye.
Opposed? Motion passes unanimously. Thank you. That moves us down to committee reports. The first one being Active Living Steering Committee. Commissioner White.
Primarily, there's discussion, and Robbie Hass was involved with this, about an extension of a multi-use path continuing up from the lower part of the Gunflint Trail up and around. And then there was a lot of discussion about people entering when the Sawtooth or Harbor View apartments are done, the safety of trying to get into the highway and of pedestrians crossing the trail, and what are we gonna do about it, and when, or do we just wait till there's a bad thing that happens? And it was considered at the beginning of the construction, but this was determined that we'll wait and see. And we'll either do a bridge or a tunnel. Robbie likes a tunnel. I don't know. I mean, this was just a conversation. It was just like,
Yep.
what do you do? So,
Stoplight.
yeah,
Stoplight.
yeah.
Be cheaper, I think.
Yeah, well, that'll, more to come there. And it's interesting hearing tunnel talk, because I don't remember how many years ago they were talking about that too, but I think that had to do with the Sawtooth Bluffs master plan, and just
Oh.
how do you access that safely and all that. So interesting that that's happening now with the housing too. All right, next one is Arrowhead Economic Opportunity Agency, Commissioner White.
They do not meet until next week, I believe it is.
Okay. Anything from Arrowhead Health Alliance, Commissioner White?
No, we didn't meet this week. We met last time around and approved the contract.
Excellent. Arrowhead Regional Corrections, Commissioner Gamble.
Thank you, Mr. Chair. Last time we met, I gave my report in the previous meeting, and we meet this Friday.
Thank you. Child Care Solutions Subcommittee, Commissioner Storley.
Thank you. We did not meet, but I'm very grateful for the $383,000. And, when we do meet, we'll have some good discussions.
Awesome. Thank you. Community Health Board, we did meet. One of my favorite parts of it is always hearing from our medical consultant, and this time it was about fluoride and just different statistics about fluoride around the country and around the world, and just having to do with concerns of fluoride poisoning, and just how fluoride works with teeth and bones and the rest of the body. And it's pretty interesting. There are a number of cities who do not put it in their water. There's also a musical about it, so I'm curious about that. But there's been extensive research done on it and just the impacts and the safety of it. So, but it's coming to the national spotlight, and so I'm sure we'll hear more about that. But the long and short of it is, I think it was like 1.5 milligrams or parts per million or something like that. That is generally accepted. Toxicity is around 4 parts per million. So there's quite a sway there. And there are wells in the United States, I guess mostly in the Southwest, that have levels beyond that 4%. And then, and then there's slightly different standards globally, whether it's the 1.5 and the 1.7. But Frank, do you have anything else to
Yeah,
add there?
1.5 is what's usually used in municipalities in the U.S. And, as Commissioner Mills just said, that's far below the level that we've seen toxicity, which is about 4 to 5 parts per million.
And that we have actually seen wells that have high levels of fluoride
Here?
locally. And we have a grant with Land Services to do free well water testing. So if anyone's curious about their well water, there's a free well water testing program. Pick up your kit and Land Services.
And they test for fluoride?
We do, it's a comprehensive well test.
Great. Great.
I'll just repeat that for the benefit of anyone listening online. Grace was just referencing the grant-funded well water testing program that we have in partnership with Land Services, which does include a fluoride test.
And it is also, there's not a microphone by Grace, there are wells in Cook County that have high levels of fluoride that it's worthwhile testing for, so now it's all on the microphone.
Thank you.
Thank you, Grace, and thank you, Frank. Is there anything else you'd like to share from that meeting?
No, I think
okay.
that was
Okay.
Except I saw Dr. Kufal in town a couple days ago.
Oh, really?
They were doing skiing, yep.
Oh, great, yeah. I'm a fan. Let's see here, Cook County Local Advisory Council for Mental Health, Rana.
Okay. We met and we had a lot of discussion. In particular, Rosio was talking about the adult survey that they did working with youth and talking about protective factors for children, parent support, healthy parenting, work stress high for families, and she is working with financial things to get help with that, and maybe this grant, I don't know if that would affect that, but youth programs and mentoring stopped when we had COVID, and a lot of it hasn't completely returned again. And another issue was just transportation for after-school programs for kids in this area, which, again, there used to be a bus, now there's not a bus. It's a long way for parents to drive, if they're working especially, and so that's kind of an issue that was brought up. There is no discussion, no immediate solution for it, but that's something to think about, because for a lot of students, that's very helpful for them to be able to have after-school programs and maybe not be home alone after school too, I don't know. But, we talked about the program for cannabis use, educating parents a little bit about that. And Grace and Rosio will present to school staff on prevention, talking about drug use, I think, or
Yeah, Rocio was at the school on Thursday during the professional development day, sharing some of the survey results that she had gathered that she presented to the council last Tuesday.
Okay, good. And I don't know about the resignation of Al now. Was she working with the schools? Were they working with the schools?
Al was leading and supporting our youth programming after school and within the school. So we're in transition right now in terms of, how to continue the great work. And,
I think that was a very important and helpful program from what I've heard. So I think that's about what we talked about. Some of the financial things that we already talked about here, so.
Yeah, if I may add, Rana, a couple things that we're working on is facilitating a future presentation with Outfront Minnesota, which is a statewide organization that supports LGBTQIA2+ youth. And the topic that we're looking at having them come in and present on is that intersection of mental health and specific challenges for LGBTQIA2+ youth and people in general. We're also, Grace is connected with staff at the Community Health Board regionally to identify a speaker to come in and present on the intersection of housing and mental health, knowing that that's another challenge in our community. And at a regional level, the Arrowhead Behavioral Health Initiative just came out with a needs assessment based on research throughout the region, so we'll be diving into that at a future meeting as well.
Thank you. Good. Yeah, I think schools, getting the children started on a healthy path of life is really going to save a lot of money and heartache in the end. So I think whatever we can do is really important. Thank you. My personal feeling.
All right, thank you, Anna. The next one is the Restorative Justice Committee, Commissioner Gamble.
Meet tomorrow.
Thank you.
First meeting.
We have the Council on Aging, Commissioner White.
They are interviewing grant writers, They had 2 applicants. I don't know what the decision was. The executive board will be making that decision.
Thank you. Emergency Preparedness Committee, Commissioner Sullivan.
Certainly. We had an opportunity, and I want to thank Allison for really leading that group when we met last time. Mike Keyport was unable to attend, and so she stepped in and did a great job. But we debriefed about the recent power outage in the city of Grand Marais, talked about a mobile generator, and also talked about how Public Health and Human Services were prepared to step in and set up a warming shelter at the community center if need be. Talked a lot about communication around that point, and also, which Allison referred to earlier, the Magnet Project, where there's information about what to do in the event of a power outage, and that will be coming out this spring. We discussed at length the hazard mitigation plan that the county is working on at this point in time, and we had great participation. Commissioner White was there as well, and we had representatives from the city of Grand Marais, Grand Portage, ISD 166, Soil and Water, the county, the DNR. We had members from volunteer fire departments and state parks. And so really a broad perspective was given to looking at our hazard mitigation plan. And basically we prioritize some of the hazards. Is it more likely we're going to have a mudslide or a fire? We did some of that work. We talked about local vulnerability, for example, the grade not being open, and if we can't use Highway 61, how is that going to impact us? What will we do? And then also looking at just vulnerabilities in terms of our population, the fact that we are an older population, and how does that impact our ability to deal with hazards and emergencies? And then under discussion, and there really weren't a lot of answers, but the changes in FEMA grant funding. And so what at a federal level could impact us here in Cook County, and that's kind of remains to be unknown at this time, but Mike Keyport has put together some good proposals to go to the state to ensure that we have the emergency funding that we need to take care of our population.
Thank you.
Anything you want to add, Allison?
Oh, that was a great summary. Thank you.
Great, thanks.
Let's see here, we're on to the Healthcare Planning Committee, Commissioner Storley.
We have not met.
Okay. Anything from NACO?
NACO, yes. We are busy every week having discussions on Zoom about what are some of the important features to present at the National Convention. I'll just pull a few. There's over 39 different resolutions, and then we're winnowing those down Wednesday and then next week also. Of course, housing assistance for homeless and veterans and families with children and the elderly, so that's an ongoing, along with mental health from, young people to the elderly. Reasonable health care coverage across the country, and reasonable means we don't know because each county has their own health care coverage, but maybe in some areas it's not very reasonable to those folks. One of the things that's interesting is that the food insecurity in rural areas is getting to be a big topic among us. And not that you're looking at federal money, but more like recreating something within a community. And I know Commissioner Mills has been working on the food distribution here in Cook County. I think we're doing, fairly well with if we have some extra food sources to drop them off at the grocery stores. And so I think we are slowly, working with that food insecurity, not necessarily having monies to go toward it, but just community effort and so forth with that. One of the interesting ones that I just pulled only because it is a big concern, 29 commissioners supported counties to increase their budgets for poll workers. Evidently, there are poll workers who are almost volunteering rather than being paid to come for the election day and for training. So that rose to the top as a concern across the country. And we're good here because we did have that increase over the last couple of years for election workers. So, maybe they want more. I don't know. We always want more. But it's interesting that it's going across the country with people who, you feel like it's a commitment and you want to be the election judge and you want to have the training. And, well, why not volunteer? Well, it takes time and it takes effort. And there is some encouragement for younger people, like seniors in high school, to be part of that effort too, which then, will continue on for their future perhaps in the county. So we're meeting again tomorrow to get some of these resolutions formed. There's a lot, transportation and agriculture and you name it, but I'm on the health committee, so I kind of stick with that, but I support anybody, especially in agriculture, with this scenario that we have going on right now. So that's my report for that.
Thank you. Thank you for your advocacy and efforts there. Please, Commissioner Wall.
What does a poll worker make in Cook County? Do you have any idea? Is it a stipend?
I don't know, it seems like, I think it's about 16.
About 15,
I think it might be
$16
$16, 15, $16
For the day.
an hour.
An hour.
An hour.
an hour. Yeah.
So you if you take the training, usually 2-hour session, and then you work, the primary, whatever, so you just track that and turn it in just like you do on a regular expense report here, but I think it's 16 an hour.
We always have quite a team that put their name in, and so I think they're very active. I know they're very active here to be a part of the election.
Thank you. Northeast Minnesota Office of Job Training, Commissioner Gamble.
Haven't met yet.
Okay.
I think there was maybe a conflict with the Government 101 on the initial meeting, but that might have even been postponed at that time. But, so that's upcoming.
Okay, thank you. North Shore Collaborative, we did meet and looking at different criteria, hopefully getting a system in place for our grant selection, just getting a better handle on that. There's always a lot of turnover on this board and it's hard to have continuity. And collaboratives around the state have been folding basically, and so it's good that we still have this one. There are questions about its future. And then just also discussing about what sorts of just that kind of cost analysis, bang for the buck, number of children served versus the cost of whatever request is and that sort of thing. So good discussion. We'll probably have a better discussion in April. PHHS Advisory Council, Frank.
Thank you. Yes, we met last month, and one of the upshots of the meeting is that I am sitting here because the member of the Public Health Board is ex officio the chairman of the Public Health Advisory Council, Human Services Advisory Council, and we were not able to elect a new chairperson. The bylaws, I believe, Allison, what we had determined was that there's a requirement that the chairman have a certain tenure, certain years of experience before starting the position. And it has been a tradition, although not written into the bylaws, that the vice chairman would serve 1 year as vice chairman and then succeed to chairman, which is, again, it's a tradition, but not part of that. We did not have any person who met the experience requirements and was willing to assume the role of the chairmanship. So, Allison, I'm going to tap on you also here. And I believe what we wanted to consider was dropping the experience here, which I'm of mixed minds about. But that would be a change to the bylaws that would have to be approved by the board. And there's no prohibition against a chairperson serving a second year, a second term. I not quite recused myself, I'm still here, even though there was no election, because I overestimated my availability, and as a result, I have missed several public health board meetings, which I apologize and feel very badly about, but they could not be helped. Upcoming, I have some diminution in my responsibilities. I am no longer working at Centers for Disease Control. I don't know if you heard that, but day after inauguration, my contract was terminated. Among many other people, CDC lost like 10% of its workforce, and those were full-time government employees, not contract workforce, as I was. So that may improve somewhat over the year, but I can't promise because things are unpredictable. And that is what I wanted to thank the board very much for the opportunity to serve with you. I've learned a lot, and hopefully I've contributed a bit. And beyond that, I don't know who'll be sitting in this chair next meeting.
Certainly grateful for what we have you for and what you bring to this board and our community. So just appreciate all that you've done and can do, and very understanding of whatever you need to do in the future. So thank you. Commissioner Campbell.
Yeah, and just to follow up a bit on that, Frank, the discussion, looking at it, I think we left with the intent that we would look and try to visit what informed the decision in the first place as far as the policy on the one-year requirement. And if we wanted to revisit, realizing we'd have to change the bylaws, but that we might want to put in language that would indicate that if a person went in as vice chair, that the chair would mentor that individual into the role. So however we want to do it to build integrity into it, I think you alluded to a group that and we're finding some associations are no longer, existing because of the lack of the volunteers available and the aging, the population. And so we have to step back and figure out how we're going to do this to be effective, but we want to keep focused on the intention that informed it in the first place so that we have good continuity and transition. So that's sort of where we left it. Fisherman Picnic's a great example of, it's supported like a lot of people that, that's what you did, but where are the people to pick it up moving forward?
Let's see, in the Cook County Food Access Council, we have not yet met since the last meeting, and it's scheduled here in the near future. I don't have my calendar up for that.
It's Friday?
Yep.
10:30 or
We have
what?
the Mission Vision Bylaws group on Friday this afternoon, in the afternoon of this Friday.
Oh, okay.
And then the larger group is going to meet early March.
Okay. Thank you. For the good of the order, anything anyone likes to share? One thing I just wanted to share, it's a little outside this meeting's scope, but an opportunity for outdoor recreation, which I think is important for physical health and mental health and just quality of life. The regular board meeting, we had passed a support for the snowmobile trail to allow for ATVs contingent on letters of support, and it does not appear that those letters of support will be procured. There was some discussion at the state level about having funding to look at this. And my understanding from the community and the board is there's a lot of concern about unknowns regarding impacts of this. And so I've reached out to the DNR to see if there are ways we can find those unknowns out without committing to going all in, which like I said, I think in the community there was concerns of just handing it all over to the state and not having as much of a local voice in the process, and so waiting to hear back on that. But I wanted to share that with the board, just to know that there are opportunities to make improvements, but it's important to look into it and find out the ins and outs and the impacts therein, so. Nothing, no outcome to share, but just part of the process, I guess. Anyone else? Well, then we're at the end of our agenda, so I'll call it adjourned. Thank you.
I know,
So is the ATV and the snowmobile trail,
pastime.
is that year-round, or what is that?
It's my knee.
I'm sorry?
For some reason, citizens
Is that the
don't understand.
ATVs on the snowmobile trails, is that year-round, or what's the proposal?
Yeah, currently the CJ Ramstead Trail, in Cook County does not
thank you.
allow for ATV use,
All right.
off-season.
So you applied for that?
Snowmobiling?
just to-
Okay.
because you had any extra-
And so other counties
use the
do
debit
include it
card?
for the
Well,
off-season
no, I think
snowmobiling.
it routinely
And in order
expires when
for
we apply.
them to
That
look
time
at
of
it,
year is
we needed to, in order for the CJ Ramstead board to look at it, it needs to be part of
I just open it
the
up just to make